ဒီ session လေးကိုအခုလိုမျိုးမပြတ်မကွက်နဲ့အချိန်ပေးပြီးတက်ရောက်ပေးတဲ့ participant တွေအကုန်လုံးကို Serenity team ကိုစားကျမကကျေးဇူးတင်စကားပြောကြားလိုပါတယ်ရှင် Care for Caregiver online webinar ရဲ့ပထမဦးဆုံးရက်နေ့မှာတော့ Sub Convention for Caregiver ခေါင်းစဉ်ဖြင့်ဒေါက်တာပန်ကနေပြီးဦးဆောင်ပြီးညဝေမှာဖြစ်ပါတယ်ဒေါက်တာပန်ရဲ့နာမည်အပြည့်အစုံကိုမိတ်ဆက်ပေးချင်ပါတယ်ရှင်။ဆရာနာမည်ကတော့ဒေါက်တာဘန်ဂျမင်ဝစ်စတိန်ဖြစ်ပြီးတော့ဆရာက PhD လိုင်စင်ရ Clinical Psychologist တူလည်းဖြစ်ပါတယ်။လက်ရှိတွင်ဆရာကထိုင်းနိုင်ငံချင်းမာ University မှာစိတ်ကုသုံးပညာရှင်အနေနဲ့ရော Professor အနေနဲ့ရောပါဝင်လှုပ်ဆောင်နေသူတူလည်းဖြစ်ပါတယ်။ဒါကတော့ဆရာအကြောင်းအချင်းချုပ်မိတ်ဆက်ပေးချင်ပါတယ်။အခုဆိုလို့ရှိရင်ပေါ့နော်ကျွန်တော်တို့ဒီရဲ့ session လေးကိုဆရာကိုအချိန်လွဲပြောင်းပေးခင်မှာ Serenity ရဲ့ founder တူဖြစ်တဲ့ဆမ NS လူကိုဒီမနေ့အတွက်ပေါ့နော်အခွင့်အမှာစကားပြောကြားပေးဖို့ရန်အတွက်ဆမကိုဖိတ်ခေါ်လိုက်ပါတယ်ရှင်
Thank you ပါမင်္ဂလာပါအားလုံးပဲ good morning ပါ Serenity ရဲ့ကျမတို့mental health ပေါ့နော်စိတ်ကျန်းမာရေးကျမတို့ပြည်သူတွေကြားထဲမှာစိတ်ကျန်းမာရေးအခြေအနေကောင်းဖို့စိတ်ကျန်းမာရေးကိုမြင့်တင်ဖို့အတွက်နည်းလမ်းမျိုးစုံနဲ့လုပ်ပေးနေတဲ့အစီအစဉ်တွေတွေကတစ်ခုဖြစ်တဲ့ဒီ Care for Caregivers ပေါ့နော်ကျမတို့ပြည်သူတွေထဲမှာပဲရှိတဲ့ကျန်းမာရေးမဟုတ်ဘဲနဲ့ပြည်သူတွေရဲ့ကျန်းမာရေးကိုဂရုစိုက်နေတဲ့သူတွေကိုလည်းသတိရတဲ့သူတွေရှိပါတယ်ဆိုတော့အနေနဲ့ဒီအစီအစဉ်လေး webinar လေးကိုလုပ်ပေးရခြင်းဖြစ်တယ်ပေါ့နော်ဆိုတော့ဒီ webinar လေးမှာတော့ကျမတို့စိတ်ကျန်းမာရေး level မှာနည်းလမ်းမျိုးစုံပုံစံမျိုးစုံနဲ့စိတ်ကျန်းမာရေးကိုဂရုစိုက်ပေးနေကြတဲ့သူတွေပြီးလို့ရှိရင်ကိုယ်တိုင်လည်းကိုယ့်ရဲ့စိတ်ကျန်းမာရေးအခြေအနေကိုပိုပြီးကောင်းအောင်ဂရုစိုက်နေတဲ့သူတွေအများကြီးပါဝင်ကြမယ်လို့မျှော်လင့်ပါတယ်အချိန်ပေးပြီးတော့ပါဝင်တဲ့အတွက်အားလုံးကိုကျေးဇူးတင်တယ်ကျွန်မဒီ session မှာဆရာကကြိုပြောထားတယ်3နာရီထက်နည်းနည်းလေးကြော်လိုက်မယ်နော်တဲ့ဆိုတော့ကျွန်မအရှိကြီးစကားမပြောတော့ဘူးပေါ့နော်ကျွန်တော်တို့ရဲ့ Serenity ရဲ့ program တွေအတွက်ဒီလိုမျိုးအခုလို direct session ပေးတဲ့အနေနဲ့ဖြစ်ပါစေကျမတို့ကို training ပြန်ပေးတဲ့အနေနဲ့ဖြစ်ပါစေအများအား support ပေးနေတဲ့ကျမရဲ့ဆရာဒေါက်တာဘန်ကိုလည်းကျမကျေးဇူးတင်တယ်ပေါ့နော်ကျမတို့တခုခု program လုပ်ချင်တယ်ဆိုတိုင်းမှာအများတန်း ready ပဲအစင်းနဲ့ yes ပေါ့နော်ကျမတို့အတွက်ကိုပြန်လိုအပ်တဲ့support ဆိုလို့ရှိရင်လည်းအများနဲ့ကျမတို့သင်တန်းတွေတက်ခွင့်ရတဲ့အတွက်ဒီကျမတို့ရတဲ့အခွင့်အရေးလေးတွေကိုmental health field မှာလုပ်နေတဲ့သူတွေအားလုံးကိုလည်းပြန်ပြီးတော့ share လုပ်ပါတယ်။အကြောင်းသားဟောင်းတွေလည်းအများကြီးတွေ့ရတဲ့အတွက်ဝမ်းသာပါတယ်။ဆိုတော့ကျမတို့ session လေးကိုဆရာကိုပဲကျမလွှဲပေးလိုက်မယ်ပေါ့နော်။ But before that I would like to say thank you to Dr. Ben for sharing your knowledge, time and expertise and always bring Myanmar close to your heart. I won't take so much time. I know you need more time, so I'd like to welcome you to the webinar. Thank you.
Okay. Should I? Oh.
Yes. ဟုတ်ဒီအမှားစကားပြောတော့ပြရကျေးဇူးတင်ပါတယ်မတ်ဟုတ်ဆိုတော့ပေါ့နော်မင်္ဂလာပါကျမကအဖြူပါဒီနေ့ကျမပါဝင်သွားမယ့်နေရာကတော့ဒီဆရာတို့ဆရာမဝင်မေးတဲ့မိခွန်းလေးပေါ့နော်မိခွန်းလေးကိုဆရာကိုပြန်ပြီးတော့ဒီဘာသာပြန်ပြီးမေးပေးတဲ့အပိုင်းကနေပြီးပါဝင်ပေးတော့မှာဖြစ်ပါတယ် Welcome to our Care for Caregivers event and we are honored to have Dr. Ben with us today sharing his expertise and insights on this important topic. So yeah, thank you again Ajahn for your dedication to supporting caregivers. And yeah, let's make this event a memorable and impactful event together. We hand over to you, Ajahn.
Wonderful. Yes. What a wonderful intention. Minglaba, everyone, and welcome. And Jesu Timbare. Thank you, Sengnumai and Apu and Agnes for such a wonderful welcome. And thank you so much to the team at Serenity for inviting me and for all your hard work to make this event possible. Because this is a time when it's just so important. We're all working, all of you are working incredibly hard. The needs are so great at this moment in Myanmar. And so it's so important. It's a good form of self-care for us to take the time to be together and to learn some new things. And also hopefully to have some time, give you some time to maybe connect with each other a little bit as well. But very much I want to acknowledge and thank the whole team of Serenity Mental Health for all the hard work that you've put into making this event possible, so that I have the opportunity to come and share some things that I hope will be very useful for you. And I did share in the chat a document that you can download, which is just a list of the skills. In case you'd like to keep track of the different skills I'm going to teach today, you can download that document, and it even allows you to edit and make some notes about which skills you like, because please don't expect that you will become a master of all these skills today, but that you have a chance to sample them. And then you'll be able to see what you like, what works well for you, and what you might like to practice, and then hopefully share with your own clients and people that you're taking care of. Is everything going okay with the sound and interpretation? Okay, great. Thanks, Agnes. So let me begin. And let's see, share screen. So today our topic is self-compassion for caregivers. And I love this little cartoon from a mindfulness teacher in North America, Elisha Goldstein. Make sure that we give respect to other people, that we respect the confidentiality of other people. If other people share things in a breakout room, we should not repeat that to everyone, to anyone outside the webinar. And of course, the importance of kindness, kindness for yourself and kindness for others. So these will, please take a moment to offer agreement with these. Okay, so let's begin. We're so busy and our minds are so distracted by so many things. It's good to just begin by taking a moment to tune in. And the tuning in is an act of simply bringing the mind to the present moment. It's very simple. It's we don't have to go to a special room and sit on a special cushion in order to contact the present moment. It's something that we can do anywhere, anytime. So let me invite everyone to just begin. You may close your eyes, but you may have your eyes open. It doesn't matter which one. If you do have your eyes open, I suggest you look down at the floor so that you're not looking at your screen. And just take 3 breaths. Feel your body breathe in and out 3 or 4 times. Just feeling your breath. And then release your effort and let your body breathe, and just take a moment to feel yourself sitting in this chair. Bring your attention to feel the contact of your body. You feel it along your seat. You feel it along your back. Just noticing how it feels to sit in this chair right now. This is not good or bad or right or wrong. This is just how it feels to sit here. And now taking a moment to tune in to yourself. Letting your attention scan through your body from head to toe. And just notice what's happening. What's happening for you right now? That is, what feelings or sensations or energy do you notice in your body? Maybe you still feel full from breakfast. Maybe you didn't eat and you feel hungry. Maybe you feel tired. Maybe you feel fresh. Just see what you can notice right now. And whatever you notice, just let it be. Don't have to work on it right now. You don't have to do anything right now. You're just noticing it. And if you like, you might wish to just make a very small smile. If you can do that without forcing yourself, just curving up the corners of your mouth and the corners of your eyes a little bit, like a half smile. And noticing how that feels. And if you like, you can direct that energy of your smile back to yourself, to appreciate yourself for taking the time and energy to come to attend the webinar. And then take one more breath and open your eyes. And if you like, you could write one word in the chat, just one word in any language. How do you feel when you just take 3 minutes to tune into yourself? One word. What do you notice? What do you experience? Yeah, and then you can read what other people write. No need to. Oopsie daisies. Mm-hmm. Yeah, you can notice how we have many different experiences. So now take a moment. I'm going to ask you 2 questions just to reflect as we're here to talk about self-compassion for caregivers. So we're going to start just briefly by talking about caregiver stress. So take a moment to reflect and to ask yourself, how is this situation now has been going, and this situation in Myanmar, to check in as you do and ask yourself, how is your stress affecting you? The stress of living during a civil war, the stress of worry about your family and yourself and the people you care about, and the stress of giving care. How is the stress affecting you psychologically and physically? What's the impact of the stress on you? We don't have to write in the chat box, just reflecting for yourself. What's the impact of the stress on you? And now ask yourself a second question. You're taking an inventory So first question, how is the stress affecting you psychologically and physically? And second question, what is your self-care? What do you do to take care of your stress? What are the things that you actually do? And some of you may think, oh, I'm not doing anything to take care of my stress. That's okay, if that's the answer. What is your self-care? What are you doing to take care of your stress? So those two questions for reflection. How is the stress affecting you psychologically and physically? And what is your self-care? So now we're going to go out into breakout rooms, and you have a chance to share with each other and to connect with each other. When you're in the breakout rooms, please turn on your camera if you can. It doesn't feel good to be in a breakout room with just these blank squares. So please turn on your camera. Please remember your agreements. Please remember your agreements that to be respectful and kind to everyone, regardless of a status or position. In this webinar, we're all equal. And please give everyone in the room an opportunity to share as much. So there'll be 8 minutes on the clock, and you will have either 3 people or 4 people in the room. So it's not a long time, but just an opportunity to share. Of course, if someone says they don't want to share, that's okay as well. They can just be a listener. So again, please get ready to turn on your camera. Remember your agreements, and please make sure everybody has an opportunity to share. How's stress affecting you? And what is your self-care? Okay. I am going to open the rooms now. Welcome back, everyone. Welcome back. If you'd like to write your best idea for self-care in the chat box, please go ahead. But let's make sure that we put ourselves on mute if we have background noise. Maybe one of the co-hosts could also check that. Some participants are having difficulty with that. Yeah, I really appreciate Suri's comment. We're going to talk about that in a minute, right? Amazingly the same. I call that common humanity. Right? Good. Wonderful. Thanks everyone for sharing. And we really want to give you some chance to connect with each other. We'll do some more breakouts in the after the break, after we go to the second half of the workshop. We'll have some opportunity to go back and talk with the same people a little bit. But let's dive in. Let's dive in. So I want to share with you, I'm going to use a psychologist definition of self-compassion. This definition was developed by a social psychologist, Dr. Kristen Neff, who was also a meditation practitioner for many, many years. Dr. Neff is also a single mother with a severely autistic child. And she, in fact, she developed her model of self-compassion because she was trying to understand how people can manage overwhelming stress. Because she was in the role of being a caregiver, even more so than a regular parent. You can read about this in her books or hear it in her YouTube talks. I'll share some links with you later. But Dr. Neff's model, and we now have, I'll talk about the research very briefly, but we have very good evidence that this is a really valid model. Dr. Neff's model has 3 elements, and I'm going to introduce each of the 3 elements to you. The first element is mindfulness, or contacting the present moment. The second element we call common humanity, which means recognizing ourselves as human. And the third element is self-kindness, learning to respond to myself as a friend. Now, I'm going to go through each of these 3 elements with you in detail. Before we go on, I want to make 2 points that I feel are very important for you to know. Number 1, this is a recipe, like a recipe in a cookbook. So I'm going to give you the standard recipe, but when you cook it for yourself, you can change it in the same way that if you learn a recipe, and then when you make it at home, you like it more sweet, you put more sugar in. You like it more spicy, you put more chili in. Right? So this is a very important element that you'll have to make this your own. And I'll talk a little bit more about that in a few minutes. Number 2, so this requires flexibility. And especially if you want to share it with other people, you really need to practice. If you want to teach someone else to cook, you have to cook quite a bit yourself first. So that if you want to share that, please remember that. The second thing I want to share with you is that for our workshop today, this is not a theory. These are not concepts. Mindfulness, common humanity, and self-kindness are not concepts. They are not ideas. These are realities. They are concrete experiences that you can touch and feel. And this is a very important element, and they are things you can practice. And just like a muscle, like your bicep on your arm, if you work that muscle, the nature of the muscle is to grow. So let me talk about each one in some detail. In this model, when we say mindfulness, we don't mean mindfulness meditation. Now, there are enormous benefits to mindfulness meditation. And if you are interested in that and you would like to practice that, I strongly encourage you. Research shows that caregivers who practice mindfulness meditation are better caregivers. But let's be real. Most people aren't going to meditate. I have learned this from my own clinical work with clients and groups. All the people who come in, if I teach them meditation, and when we finish the therapy, only 10%, maybe 15% will continue the meditation. But useful mindfulness, the ability to contact the present moment, everyone can practice this. And if we practice and we teach people how to contact the present moment, anytime, anywhere, almost everyone will practice it because it's not difficult. It's very simple. It's as simple as what we just did. What we just did when we did the tuning in, that was contacting the present moment. When you feel your breath, your mind is in the present moment. When you feel your body sitting in the chair, your mind is in the present moment. When you scan through your body, you're contacting the present moment, and this is like a foundation. It's so useful to us because our mind has a tendency, our human mind has the tendency to wander, to get lost in worries about the future and fears to get lost in regrets or sadness about the past, or to get overwhelmed with judgments and evaluations and comparisons in the present moment. So this is very useful. And let's, again, we just can do a quick example because our 5 senses, I don't think this is a practice for everyone, but our 5 senses are such a useful way to bring us back to the present moment. So for example, and this is, if just look around in your space, use your sense of sight and just notice the objects in your space. Maybe take a moment to notice 5 objects in your space. And just as you're looking around, you can say, oh, okay, here's the mouse, right? Here's a pen. See if you can just, for each object, look at it. Maybe you never really looked at it before. So just look at it. That's your sense of sight. And now use your sense of smell. Just breathe in through your nose and notice any aroma, any smell you can smell right now. You might like that smell, you might not like that smell, but just notice, what does it smell like right now? There may be no smell, so you can notice that. Shift your awareness to your sense of taste. So notice there may be some flavor in your mouth. Maybe you were having coffee or drinking tea. So maybe there's still some flavor in your mouth. Or maybe, again, an absence. Just notice, is there any flavor right now? Direct your awareness now to your sense of hearing. You might like to close your eyes. It can make it a little bit easier, but you don't have to. So just notice any sounds you're aware of right now. For example, the sound of my voice, or the sound of Agnes's voice, or the sound of a fan in your room, or maybe the traffic around you, all the noise of daily life in the street. Just notice whatever sounds are nearby. And then, of course, lastly, use your sense of touch, which we already did. Feel your body sitting in the chair. Feel the contact with the chair. Maybe feel your feet on the floor. Yeah, so this, and then again, just take a moment and notice, what's that like? Connecting with your 5 senses. This is not the practice itself. I will give you some other practices, but this is a sample. It's an example. The 5 senses, it doesn't matter which one, they're like a doorway to the present moment. They help to bring our mind back, because our human mind has a tendency to wander. Or our human mind has many habits that are not always very helpful to us. Which brings us to the second element of the model, which we call common humanity. I love it. One of you just wrote in the chat, oh, everyone in my group has a similar self-care. Yes. Yes, if we bring everyone in the room together, we will find many people, especially people who have a similar profession, have a similar self-care. Not everyone is the same, not 100% the same, but similar. So common humanity means that you recognize yourself as a human being. So for example, let me give you an example that we were just talking about. Many people, when they begin to meditate, or they begin to practice mindfulness, they notice they can't focus. Their mind is wandering. Their mind is thinking about the future. Their mind is thinking about the past. The mind is just wandering off. And many people then say, oh, what's wrong with me? What's wrong with me? Why does my mind wander? Oh, am I weak? Do I have ADD? Is there a problem with me that my mind is wandering? This is a person who doesn't understand common humanity. It is an established fact that this is a tendency of the brain, of all human minds, to wander. It's built in to our brain. It's not you individually. And there are so many things, we will talk more about this, there are so many things that we say to ourselves, we criticize ourselves. Oh, why do I feel this way? Why do I think this way? Why am I like that? But in fact, it's not you individually. This is part of being human. And of course, what's really difficult is when we're in pain, our human brain has a tendency to make us feel alone. We think, oh, I'm the only one who feels this way. I'm different than everyone else. I'm separate. And when that happens, that's not good for us. But of course, the funny thing is that everyone has that experience. Everyone who's in pain starts to feel like I'm alone in this pain. But in fact, this is what we call this common humanity. Really recognizing that so many things we experience are just part of being human. So we can learn to start connecting with our common humanity immediately. And I'll give you an example. So many of us ask ourselves, why? 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 When we feel a bad feeling, when we feel stressed or sad or afraid, our mind has this tendency to analyze. Can someone on the organizing team please mute the person who's or let's mute all of the participants, please. Thank you. It's so we have this tendency, our minds start asking, why? Why do I feel this way? Why me? What's wrong with me that I feel this way? And just notice, our mind never does this when we feel happy. we rarely ask ourselves, why am I so happy? Why do I feel good today? We only do this when we feel bad. It's like attacking ourselves. So if you like, you could start to practice connecting with common humanity immediately. You can start, so that when you notice, when your mind is asking why, develop some way to say to yourself, like the next time you feel scared and your mind starts asking, why do I feel scared? Or you feel angry and mind starts asking, why do you feel angry? You could say to yourself, I feel this way because I'm human. Many people facing these same challenges, they also feel the same way as me right now. This is part of being human. You can say to yourself, my feeling is part of being human. I'm not different than other people. I'm not weak. I'm not alone. I'm human, like everyone else. When you start practicing common humanity, you will start to feel better right away. For caregivers, the caregiver says, oh, we feel exhausted. Very frequently as caregivers, we feel exhausted because we have our own suffering and we receive the suffering of other people. And we feel overwhelmed or we feel helpless. And sometimes we ask ourselves, oh, why do I feel this way? Why do I feel so tired? Well, and if you have that feeling as a caregiver, if you have that feeling like, oh, why do I feel so tired? Why do I feel so unmotivated? You can start this practice. You say, oh, I'm feeling this way because I'm human. And many caregivers feel this way. It's not just me, and it's not weakness. This is very difficult. And my feeling this way is just part of being human in this profession. So again, this is not a common humanity, it's not a concept. It's not a theory. It's something you can really practice to start to recognize yourself. And when you start to recognize yourself as human, a burden of self-judgment and self-criticism will be lifted straight away. So, but of course, you'll need that mindfulness of the present moment, because you have to notice. You have to notice when the self-criticism is happening. You have to notice when the mind is going, why? And then, of course, the last element is self-kindness. The third element of the model is self-kindness. So what's interesting is that I don't need to teach you how to be kind. You don't need to learn how to be kind. You already know how to be kind. You offer kindness to other people every day. When your friend is having trouble, or when your patient or your client is having trouble, you offer them compassion and kindness. All we want to do is to start directing some of the kindness back to ourselves. Kristin Neff says the most simple definition of self-kindness is that I respond to myself when I feel bad, when I feel stressed, in the same way that I would respond to my dear friend. I probably wouldn't say to my dear friend, why do you feel stressed? What's wrong with you? I will say to my dear friend, oh, I'm so sorry you feel stressed. How can I help you? What do you need? So this is the third element of the self-compassion model. So mindfulness, that present moment awareness, common humanity, recognizing ourselves as human, and self-kindness. Responding to yourself the same way that you would respond to a friend. Now, we're not going to have time in the webinar today to go into detail, but I want to talk about how self-compassion has two sides, kind of like yin and yang. Although in English we don't use this language, we talk about tender and fierce. There is a soft, nurturing, comforting, soothing side of self-compassion. And this is what most people think about when they think about self-compassion. But there is another side. There is a firm, protecting and motivating side of self-compassion as well. So real self-compassion has a mix of energies. There is an energy of soothing and comforting. And there is an energy of protecting and motivating. And that all of it is held together with caring. So Kristin Neff uses the example of a mother bear with a cub. That the tender side of self-compassion is like the mother bear loving and accepting the baby bear. And the fierce side of self-compassion, the yang side of self-compassion, is like the mother bear acting to protect, to take action to protect the baby bear. But the mother is taking the action from love, from caring, not from rage or anger. And just, I think it's, I'm not gonna spend time on this, but this is we say that the fierce self-compassion has three energies: to protect, to provide, and to motivate. That's not going to be the focus of our webinar today, but you'll see in many of the practices we're going to do, we're going to mix both energies. We're going to mix some energy of soothing ourselves and also some energy of protecting ourselves or standing up for ourselves or motivating ourselves. Because as you know from the yin and yang, one of the really valuable things about this yin and yang symbol is to understand that inside the yin, there's a little bit of yang, and inside the yang, there's a little bit of yin. They're not really separate. So even though we say tender and fierce, just in the same way that when a mother is loving a child, right, the mother can soothe the child and also be protecting the child, and the mother can be protecting the child and also soothing the child. So, and I know that moving on, I know that some of you might be interested in the research. I don't want to spend time on this. If you're interested in the research, there's a lot of material at Kristen Neff's website. Basically, at this time, there is more than 2,000 published studies about self-compassion that suggest that it is very, very valuable to help us reduce suffering and increase well-being and good coping. So that's all I'm going to say about the research. I do want to talk about a little bit about the difference between self-care and self-compassion for caregivers. Because we have all learned about self-care, and self-care is very important, right? It's very recommended for caregivers, especially in high stress situations. And we know that caregivers who take time to practice self-care have a lower level of burnout. The difficulty of self-care, and you all gave some great examples. You all talked about you like to meet with friends, you like to go swimming, many different examples. The difficulty is that these activities are offline. We do them when we go home, or on the weekend, or in the evening, when we have time. So frequently, self-care requires us to make a choice. Sometimes we have to say no to something else so that we have time to take care of ourselves. And we're going to talk a little bit more about this later when I talk about fierce self-compassion and saying, help supporting ourselves to say no sometimes. Self-compassion is a little bit different. Self-compassion, when we practice and learn it, remember today you are a beginner, but when we practice and learn the self-compassion I'm going to teach you today, it has immediate benefits that we can use at any moment. We don't have to wait until we go home. We don't have to wait until Saturday or Sunday to practice self-compassion. Once we know how, and with a little bit of practice, we do need to give some time and energy to develop the skill. With a little bit of practice, we can start to use self-compassion in just a few moments, even in just 2 or 3 minutes. And I will teach you one skill today that you can use when you are sitting with the patient, when you are sitting with the client. So even in the moment that you are with another person, we can practice self-compassion. I want to give you 3 suggestions about how to help you do the practices we're going to learn today. The first suggestion is to understand what I've already said to you. These 3 elements, the capacity for mindfulness, the ability to recognize yourself as human, and kindness, this is already part of you. This is not something you need to learn completely new. They're like muscles. And so all you're doing with self-compassion is building a resource you already have. Now, maybe you didn't use it before. Maybe you didn't recognize common humanity before. Or maybe you've never really practiced in the moment awareness. But if you practice, it will grow because it has an organic nature, like a tree or a flower. If you water a flower and you give it good conditions, the nature of the flower is it will blossom. The nature of the tree is it will grow, and you have this same nature. So this is a resource you already have, and you can develop it. And then again, I think many of you already have been developing elements of this resource. Number two, and this is the difficult part, your experience will become your best teacher. That means that, and when we practice, I'll ask you to notice what you experience. Because only you know what feels soothing for you. Only you know what words or energy feels kind and compassionate to you. So there's an element where we have to learn to practice self-compassion. We have to learn to listen to ourselves. As caregivers, we spend a lot of time listening to other people. Also, living in society, we pay a lot of attention to other people. We direct our attention outward. Is my friend happy? Are my parents happy? Are my siblings happy? Is everything okay with everyone else? And because we spend so much time paying attention to other people, we don't pay attention to ourselves. But it's important to listen to ourselves, to start maybe even to start trusting ourselves. This is part of developing self-compassion. And lastly, this is very important for a caregiver. You know, when you go on an airplane, I don't know, some of you have probably been on an airplane and the stewardesses, the attendants come and give a demonstration. And when they give the demonstration, they say, put on your own oxygen mask before assisting other people. If you're traveling with your children and there's a problem on the plane, there's no oxygen, you put on your own oxygen mask first. And then you put your child's mask on. Or if you're traveling with your friend or your parent, you put your own mask on first before you help other people. Now, why? That sounds so selfish. Oh my God, maybe I should put my child's mask first on. Or maybe I should put my mother's mask, make sure her mask is set. Why do we say, put your own mask on first? Can anyone guess? Why? Oops, every time I move my mouse. Oh, I'm just trying to look at the chat box. I want you to guess. Why do we say to put your own mask on first? Why is that important? that's right. If there's no oxygen and I don't put my own mask on, I might lose consciousness. I might lose consciousness. And when I lose consciousness, I can't help anybody. So this is a really important thing for caregivers to understand. Very important thing. So when we talk about self-compassion, I know that you want to start teaching it to other people straight away. But you need to develop your own practice first. You need to develop, and then once you have some sense of it, you can offer the practices to other people. So my suggestion is whatever you learn in the webinar today, that you should practice on your own, and you decide, I don't know, 1 week, 2 weeks, 1 month. You should practice these things for yourself before you begin offering them to other people. But it's up to you. It's up to you. And this, of course, is also the same reason that it's so important for us to do self-care. Okay, great. Moving on. So now I want to talk about something we call resistance, because our human mind has the tendency to resist. And this is part of why there's a tendency to resist painful falling. Again, it's not individual. This is something the brain does. So I want to show you, well, actually, let's start with a video. I'm going to show you a video. So let me set up. And this is a video that illustrates what resistance is. Here we go. We're gonna, okay. So hopefully you will be seeing my video clip and you will be hearing the sound from my video clip. So please take it's just 3 minutes to watch this video. And I want you to notice, what do you see? So I want you to take a moment to reflect and think about what you just saw. What happened? The samurai, the warrior, was annoyed by a fly, and he started to fight with the fly. What happened when he fought with the fly? This is and what happened when he stopped fighting? When he just let it be. This is really important. You notice the fly was still there at the end. In the end, he's holding the fly in his hand. The fly didn't go anywhere. It didn't disappear. It didn't vanish, but he's not fighting with it anymore. So what's important here is that when we resistance is wanting our present moment experience to be other than what it is. And again, I'm not right now, I'm only talking about thoughts and feelings. I'm not talking about the social world or anything outside. I'm talking about in our minds. That's all. I'm not, please don't be confused about the use of the English word resistance here. So it's when we struggle with our thoughts and struggle with our feelings. Now, first of all, this is normal. Again, it's part of having a brain. When something's painful to us, we want to get away from it. If you feel burned, you move your hand, right? Our mind works the same way. It's a natural human response. But we know that this resistance is an obstacle to self-compassion. When we fight with our thoughts, when we fight with our feelings, it prevents us from being aware and self-compassionate because because pain is a natural and inevitable part of life. And let me be very clear. If you're part of a family, you probably love the people in your family. But guess what? Sometimes you get very angry at them. Sometimes you feel hurt by them. Sometimes they feel hurt by you. This is right. This kind of pain is normal. But then when you go, oh my God, what's wrong with me that I get angry? How could I possibly get angry at my older brother? How could I possibly get angry at my mother or my father? Right? That's resistance. And what you resist, this is a little rhyme. What you resist persists. Resistance amplifies psychological pain. The thoughts, and when you struggle with a thought, I don't want to think that thought, don't think that thought. When you struggle with a feeling, I don't want to feel that feeling, I'm going to push it away. It gives that thought and feeling more power over you. So usually we say, if it feels like a struggle, it isn't self-compassion. Whatever that is, that's not self-compassion. If it feels like you are fighting with yourself, if it feels like you are fighting with your thoughts, oh my gosh, I can't make this thought go away. It's not working. Nothing is working. That's struggle. That feels like struggle. Whatever that is, whatever you're doing there, that's not self-compassion. And this is really, so part of developing self-compassion, especially these first two elements, the mindfulness and the common humanity, we learn to acknowledge, recognize, and accept our own thoughts and feelings. All of our thoughts and feelings. Because every thought you have, you have some thoughts you like and you have some thoughts you don't like. Maybe some thoughts you feel ashamed of. Every thought you have is a human thought. And other people have that same thought too. Every feeling you have some feelings you like and some feelings you don't like. And maybe some feelings that you feel ashamed of and you don't want other people to know. Well, guess what? They're all human feelings. And there are other people who have those same feelings. And they might feel ashamed too. And this shame is a problem, right? When we feel, oh, my thought is not socially acceptable. My feeling is not socially acceptable. Like, I'm a caregiver. I should always be nice. I should always be kind. I should always be grateful. That means that's resistance. I'm fighting. This is about authentic kindness, authentic compassion. Authentic compassion means truly accepting all of our thoughts and feelings. Because if a friend came to you again and said, oh my gosh, I'm having this terrible thought and I don't want anyone to know, I don't think you would judge your friend. You would say, oh, I'm sorry you're having that thought. Let's talk more about it. You know, because the more we struggle, the more we suffer, referring to our own thoughts and our own feelings. So I want to teach you a practice. I want to teach you a practice that we can start with. Actually, sorry, before we do that, I'm going to ask you to do a quick personal reflection now that I talked about resistance. This is not for the chat box. It's not for the chat box, but just for you, and you don't have to share it. I'm not going to ask you to share it. Which thoughts and feelings do you resist? Which experiences do you resist? And everyone's a little bit different. So maybe you don't like feeling alone. Or maybe you don't like feeling angry or sad. What are the thoughts and feelings of your own? What are the experiences of your own inside your own mind and your own body that you resist? Again, this is not for the chat box, it's just for you. What do you struggle with in your own heart? And just going to give people an opportunity to reflect and make some notes. So before we go to the break, I want to start giving you some tools. The first tool I'm going to give you is what we call 3 self-compassion questions for daily life, which means these are ways to develop your mindfulness and self-compassion. It's very simple, where you kind of stop, you take a breath, right? Feel your breath, just one breath. And then you just ask yourself in your own mind, you ask yourself. So this first question we call the mindfulness question. We call the mindfulness question. And you just ask yourself, what's happening right now? What am I feeling? What am I thinking? So you notice the action of your own mind. You stop, you take one breath, and you ask yourself, what's happening right here, right now? I'll give you the other 2 questions later, but that's the first question. And in fact, you can make this into a whole practice that we call STOP. S-T-O-P. It's a very useful practice. Really, it should be called pause, because it doesn't mean you stop your whole day. You take a little pause, but P-A-U-S-E was too difficult. We call it the STOP practice, S-T-O-P. Sorry, Agnes, it's okay if you don't translate all that. So S is for stop. Like I just said, you stop, you pause where you are. And T is for take a breath. And then O is for observe, like we were just saying. What are you feeling right now? And importantly, are you resisting or struggling with your experience? Are you feeling something and you're saying, don't feel that way? I don't like that. To yourself. Because if you notice, if you observe that you're struggling, you can start to practice being human, being common, having common humanity right away. If you notice you're struggling, you can take a breath and say, well, wait, that's part of being human. I don't have to fight with that. And then P just means proceed. Just go on with your day. Because sometimes it's enough to just take a few moments just to see it. And when you see it, you can already release it a little bit. Because when we're lost, as we were talking about before, we have a very strong habit. All of us have a very strong habit that our mind is running into the future, into our preparing and planning and worrying about the future, about tomorrow and next week or tonight. We have a very strong habit that our mind gets lost in the past, into regrets or review about the past, or that our mind just gets lost like judging and evaluating the present moment. This is bad. I don't like this. And we get lost in that. This is a very simple practice. This just to bring present moment awareness, bring this useful mindfulness right into your daily life. You don't have to go to a special place. You don't have to wear a special set of clothes. You don't have to sit on a special cushion or burn a special candle. You can practice this anywhere, anytime. Stop, take a breath, observe what's happening. Are you resisting or fighting with yourself? Take a breath, just then proceed. So please try that. Please try that. Oop, okay. So at this point, it's we're going to take a 10-minute break. Remember, if you have questions as we go along, please send your questions to APU, because at the end, we will have a Q&A session. I won't take questions in the middle, but I will take questions at the end. You can send your questions, of course, in Burmese to APU, and you can send them in English, and she'll put them together. She will create a list of questions. Or you can just save your question until the end as well. So now we'll take a break for 10 minutes, and please do something good for yourself on this break. Hope everyone had the opportunity to do something good for yourself on the break. And now that I've kind of introduced the model and talked about how to kind of some very simple ways to really just notice and appreciate what your mind does, and to really bring this kind of useful mindfulness, in the moment mindfulness. Now I want to specifically start talking more about the kindness piece and the practices of self-compassion. And you'll see that each time we do this, you're gonna really see that it's embedded in this sense of common humanity. Because again, common humanity just means recognizing, what does it mean to be human? What does it mean to have this brain and this nervous system and this body? Because we feel so individual, but we all have more or less the same brain. This brain that's been developing for so long, so many millions of years. And it has certain characteristics and properties, and the same with this body. So many of the things that we criticize or judge ourselves for are just the product of being human. So let me share my screen again and talk about some techniques for this kind of tender side of self-compassion. And again, I don't want to spend too much time on this. I don't want to talk theory, but as I said to you, this kindness and this self-kindness, it's not a concept. It's actually built into you. The inclination to be kind is built into us as beings. And it's part of our brain and our nervous system. We have, in common with all mammals, we have a caregiving system, what neuroscientists and psychologists call a caregiving system built into our brain, and we can learn how to stimulate that system. And in fact, there's 3 ways to stimulate that system: through gentle touch, through physical warmth, and through what we soft vocalization, which means soft speech. And you can just think about the way that we talk when we want to be kind and the way we talk when we're angry. They're very different. And of course, the important question for today's webinar is, how do you talk to yourself? Especially not just the words, not the words, but the tone. What's the tone of your inner voice? So let's start practicing this. So now we're going to do a practice we call soothing touch. Some of you may have done this before, some of you, but even if you've done this before, please follow along. I also, I mentioned this earlier, and now I want to mention it again. This is an experiment of listening to yourself. This is an experiment of noticing what this is for you. How does your body feel? So I want to invite everybody to turn off your camera so that you can feel safe, and no one is watching you, no one is judging you, because our human mind is very sensitive to social judgment, and that can be a distraction. So I want everyone to feel free to turn off your camera, and now just take a moment to sit in your chair, and we're gonna practice. We're gonna try to self-activate your caregiving system that you have within you using touch. So take a moment just to sit in your chair. Take a moment to sit in your chair. And again, just take a few breaths. Feel the contact with the chair. Notice how the energy of your body is right now. And then gently bring up one hand and just place that hand over your heart. And just notice, again, don't pay attention to me. I know you're listening to these words, but really notice, what does it feel like? What do you feel when you put your hand over your heart? What does your body say? And if you like, you can add the other hand. You can put 2 hands over your heart. Please do this in your own way. You might like to put 2 hands, one on top of the other, or you might like to put 2 hands spread out on your chest like a butterfly. You can do whatever you like. The important thing is that you are listening to yourself. What happens in your body, in your nervous system, when you do this? And again, we're just going to hold this. We're going to hold this. So you can see what this is like. And then extending, if you like, extending your hands up to your shoulders, kind of giving yourself a little hug, a little self-hug. If you like, again, you can be creative. If you like, you can have one of the hands or both of the hands kind of caress your shoulders in a kind way. Just noticing what 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 connects for you. We're all human, but we're not all 100% the same. And you're listening to yourself. And now bringing your arms down a bit, bringing your arms down so you kind of have your arms on the middle, or if you like, kind of hugging your own elbows. Up to you, again, up to you, just noticing how does it feel to you? How does it connect for you? There's no right way. There's no wrong way. You have to listen to yourself. Now, put a hand over your tummy, or put two hands over your tummy, whatever feels right for you. Just notice what that feels like. And now try something a little bit different. Now make a fist very gently, and now place the fist over your heart. This is like a symbol of the yang, the fierce self-compassion, a symbol of courage, a symbol of giving yourself strength. And again, you're just listening. How does this feel to you? If you like, you can wrap your other hand kindly around the fist as a symbol to combine strength with caring. And now you can stop, and I want you to take a moment to reflect and to make some notes. How do you feel when you do this? Maybe you're practicing the soothing touch for the first time. You know, maybe this is not the first time, but what do you notice? Remember, there's no right way. There's no correct way. I offer you different postures because everyone has to discover the posture that connects for you. And if you like, please feel free. I want to ask, how did you feel when you practice soothing touch? Sometimes I like to call it compassionate touch. When you practice compassionate touch here today, how do you feel? If you like to write one word in the chat box, please go ahead. Warm, secure, peace, getting courage, calm and positive, warm and energy, sleepy, right? Well, sleepy is a sign we feel safe. Tenderness, safe, calm and warm, strong. See, and if you didn't feel anything, that's okay. Not every practice connects for every person. And that's okay. So that's, yeah, so this is a really, and now we're gonna use this. We're gonna start combining. So soothing touch again is something we can start to do anywhere. And I'm going to give you some tips on how to use this, and we're going to put it in another practice as well. So for example, after you talk to someone, maybe you have a Zoom call with someone who's suffering a lot. And after you get off the Zoom call, you really feel like the energy of that suffering. Well, instead of running to the next call, instead of doing the next thing, or instead of eating a chocolate bar, you might like to do this soothing touch for 1 minute or 2 minutes to be a friend to yourself when you have that energy that you receive as a caregiver. So we can start to use this immediately. You do not need to wait until the weekend. And now the soothing touch is like a symbol of a really important question. So I want to give you the second question. Remember, before the break, I introduced this technique, 3 self-compassion questions for daily life. So the first question I introduced before the break was the mindfulness question. And we use the stop practice to ask ourselves the mindfulness question. So the self-compassion question is actually looks simple, but it is not simple. The second question is, it looks simple, but it's not simple. You stop and you take one breath and you ask yourself, while I'm feeling this way at this moment, what do I need? This is the compassion question. When you want to help your friend, you say, oh, how can I help you? What do you need? So this is the compassion question, and the self-compassion question is, when I'm feeling this way, what do I need right now? And this is actually not easy. It actually takes time and practice to understand this question, because it's so individual. It's so individual, this question. So on the tender side, the yin side, you might ask, what do I need to soothe and support myself like a friend right now? Maybe, are there some kind words? We'll talk about this. What would I say to a friend? Would I say to a friend, oh, it's going to be okay, or I'm here for you? Well, can you say that to yourself? What do I give a hug? Do you need a hug right now? Right? And you now have a technique to give ourselves a hug. So that's one side. Sometimes though, it's the other side. It's the yang, fierce side. What do I need to help motivate myself? What do I need to give myself courage and take action at this moment? Sometimes we need soothing and comfort. Sometimes we need to take action and stand up. And so I want to introduce this to you, but please understand that it's not easy. And this one takes some time to understand. You have to practice because you are adults. No one else can tell you what you need. You are the only person who knows what it is you need and what will satisfy that need. Looking outside you will not help you learn how to meet your own needs. This is a kind of empowerment. And I'd like to emphasize something, and we're going to talk. Many caregivers are afraid that this is selfish, or that, what does it mean if I take care of my own needs? In fact, many people, not just caregivers, many people are afraid that this is selfish, but in fact, it's not about selfishness. It's just about saying, my needs also matter. I devote a lot of time and energy to take care of other people and to give to other people, and that's fine. But it's also important to be aware of my needs and to develop my ability to help meet my own needs. It's good to have friends. It's good to have family. It's good to have other people who can help me. Sometimes I need a hug from a friend and I can go get a hug from a friend, and that's very, very good. But sometimes I need a hug and no one is there. So that's a very good moment when I have the capacity to give myself that hug. It's not a substitute. It's a complement, meaning that it's something additional. It's an additional resource so that we are more resourceful. We can get a hug from a friend. We can give a hug to ourselves. I can get encouragement from a friend, but sometimes I can also encourage myself. This is the essence of empowering myself. This takes time. This practice, I think, is the most, this idea of what do I need this is the deepest practice I will teach you today. That it takes time to understand our own needs. And we have to experiment. Like I said, no one else can tell you what you need and what will help you satisfy that need. You have to try. You try it and see. You try it and see. We call that trial and error. So I suggest for all of you, if you like, that you keep a self-compassion journal or log, which is a daily record of the skills you practice and the techniques that you use and how it connects for you. So that over time, you see, oh, sometimes this skill is very good, but sometimes this other skill is very good. Sometimes I use the stop practice and it's very helpful, but sometimes I need to stop. I need to do soothing touch. Because your needs, you'll also see that your needs are not the same every day. Your needs can change from day to day. So this can be, it can be very, if you keep some simple journal or log, so you remember what connects for you, what your needs are. Now, I just want to mention that there's many fears and doubts about self-compassion. Many people are afraid that if we are kind to ourselves, it's like self-pity. Many people are afraid that if they're kind to themselves, they will appear weak or they will become weak. Many people, and I just mentioned this, are afraid that if they think about their own needs or they do something for their own needs, it's selfish. Some people say, oh, this is self-indulgent. It's just making excuses. I'm spoiling myself. Or other people are afraid they're going to be demotivated. So there's two things I want you to know about this. Psychologists have done research on these issues, and the research shows that the opposite is true. When people practice self-compassion, they become stronger, they become more resilient, they become more compassionate to other people, and they perform better. So that's number one. Number two is even more important. When you are kind to a friend, so your friend is suffering, and you offer your kindness and support to your friend, you offer your care to your friend. When you do that, when you are kind to your friend, do you ever worry that your kindness will harm your friend? Do you ever worry that your kindness will make your friend weak, or make your friend selfish, or will demotivate your friend? Usually, no. We don't worry about this. When we offer kindness to other people, we have no fear. But sometimes when we offer kindness to ourselves, this human brain, this tricky human brain, starts to have fears and doubts. So please remember that. Maybe you will notice this today in yourself. Maybe you will start to have fears and doubts about self-compassion today, or maybe it will come in the future. But just please remember that. It's not you. It's this human brain. Because when we are kind to others, we have no doubt that our kindness is good for them, even if we can't solve all their problems. And lastly, so when you have these fears, the third question in the series is to help you with these fears. So the 3 self-compassion questions, the first question was the mindfulness question. The second question was the self-compassion question. And the third question is the question to help overcome fears and doubts about self-compassion. And the question is, how would I treat a friend? That's simple. Right now, if I had a dear friend who is feeling the same way, facing a similar situation, how would I respond to my friend at this moment? What would I say to them? What would I do for them? So we really start to notice. Oh, and because then when we do that, we shift perspective and we say, okay, now can I treat myself the same way that I would treat a dear friend? This is a very useful question to help us shift perspectives. So now I would like to put together all the things we've learned so far into one practice that we call the self-compassion break. And so you can use these things separately. You can use them at any moment, but you can also practice it as a package. So this self-compassion break has 3 simple steps. Step 1, contact the present moment. Step 2, recognize that I am human. And step 3, offer self-kindness. Ask that question, what do I need right now? And see if I can support myself as I would support a friend. So what I would like to do now is I want to practice this together right now. Because again, when we learn this skill is so wonderful, and we've heard the feedback from so many participants and trainees. Once you learn this skill, and once you practice just a little bit, people find that they can practice in their daily life very quickly. When we do it right now, it's going to take 5 minutes or 10 minutes to practice together. But when you do it at home, if you do it 3 or 4 times or practice for 1 or 2 weeks, you will find you can do it very quickly. So let's practice together right now. So please put down your pen. Please put down your device. Please let your hand be empty. Remember, in order, the mindfulness means we are present. So please put down your pen. Please put down your device. Let your hands be empty and close your eyes. And now visualize something going on in your life that is stressing you. Something happening in your life that is difficult for you. Please, because you are a beginner, choose something that is mildly or medium stressful. Please do not choose the most stressful thing in your life. So that you can develop the resource, we want you to practice with something that's not so intense. If many different things come up in your mind, you can give yourself permission to choose one. And then visualize that stressful situation or that difficulty. Who is involved? Where does it happen? What are the details? Visualize it enough so you start to feel the energy in your body right now. And then begin to practice the self-compassion break by contacting the present moment. Bring your mind back. Let go of the details about the situation and come back and feel your own body. Take a breath and feel the energy in your body. And notice what you're feeling and say to yourself, oh, I am stressed right now. Or I am upset. Whatever you're feeling, you can just say to yourself, this is what I'm feeling. This is what's happening for me right now. You can even just say, okay, I'm suffering. So just take one breath and come back, bring the mind back and contact yourself in this moment. And then begin to move to step 2. Recognize yourself as human. Say to yourself, whatever I'm feeling right now is part of being human. Many people facing that same situation as me, they feel the same way as I do. I'm not alone in this. I'm not weak. I'm not different. I'm human. This is part of being human. So we're truly acknowledging that you are human. And then moving on to the third step of self-kindness, to begin being kind, place a hand over your heart as a symbol of your intention to be kind, your symbol of an intention to be a friend to yourself. You may use the hand over the heart, or you may give yourself a hug, or any other touch that feels good for you. And then just ask yourself, when I feel this way, facing this issue, what do I need right now? Give yourself permission that you may not know. Maybe you don't know what you need. But if you do, maybe you can give yourself a little bit. And if you don't know, ask yourself, if I had a good friend who was feeling just the same way as me, facing the same difficulty, how would I support my friend right now? Even if I couldn't fix it for them, even if there was no solution, what would I say? What would I say to my friend? How would I speak to my friend? And could you try speaking to yourself the same way? And if you have no idea, if nothing comes for you, maybe you just say to yourself, may I learn to be kind to myself when I suffer. May I learn one day, may I learn to be kind to myself when I suffer. So just expressing the wish of kindness for yourself. So now I'm going to give you another minute in silence to practice these 3 steps for yourself. Contacting the present moment and noticing your experience. Recognizing yourself as human. And offering yourself kindness, supporting yourself as a friend. And then releasing the practice. And just taking a moment. Again, I want to invite you to take a few moments to reflect. Take a few moments to reflect and to notice. And again, feel free to make some notes. What connected for you? What connected for you? Kind of. And if you notice that only 1 step connected or 2 steps connected for you, that's okay. Remember, we said it's a recipe. So you can cook the recipe differently. Actually, and now we're also going to go back out into breakout rooms just for 5 minutes with a few other people. Go into breakout rooms. It'll be a little bit smaller this time. We'll see if we can have fewer people in the breakout room. We just have 5 minutes and you can share when you practice the self-compassion break today. What did you experience? Maybe today you're practicing for the first time. Maybe it's not the first time. What did you experience? Remember, please turn on your camera. Please give respect and kindness and give everyone a chance to talk, because it will be a very quick. So please give everyone a chance to talk, but it's also okay. If someone doesn't want to talk, it's okay too. Just a chance to connect with each other. Okay, here we go. Okay, we're coming back in. And of course, again, I want to invite people, because of course I'm curious, and I think the team is curious. What did you experience? If you want to write in the chat box, just 2 or 3 words. When you practice the self-compassion break today, what did you experience? Just so we can get some feedback in the chat box. Just so we can get some feedback in the chat box. What did you experience? And again, feel free to share in Burmese. You don't have to share in English. Yeah. Relax, warm, secure, relax, and calm. Again, we're activating a system in our bodies. You're not imagining these things. Yeah, I really like the way Miamyet Tue Kin expresses that, right? Again, it feels a little bit lighter. And that's right. We don't have a magic wand. We can't make our suffering and our difficulty disappear. It's not a Harry Potter. But what if we could make it 5% lighter each day? What if we could make it 10% lighter each day? What if we could make that muscle stronger and stronger? Okay. Yeah. And I want to encourage everyone to practice this, because it is a muscle. All the practices, I know these are like muscles, and if you use the muscle will get stronger. I'm going to share a link here in the chat box. This is now, unfortunately, it's in English, but the link in the chat box takes you to recordings of the self-compassion break by many teachers in English. Including myself. There's 1 or 2 on there by me and many, and Kristen Neff and Chris Germer and other teachers. So for those of you who can follow in English, you can practice this way. But I also hope that maybe some of you, I hope actually Agnes has taken the course from me a few times. I very much hope that Agnes will make a recording in Burmese. Because as far as I know, Agnes and Ong Min are the 2 people I think who have the deepest understanding about self-compassion practice, and who are professional counselors. Yeyin writes, thank you, Yeyin, for your comment, right? I didn't accept my own stress, and this helped me to flow, right? Because again, that's that recognizing common humanity. So we went from struggle and resistance, and you feel that shift. So that's really important. For those of you who felt that, the difference between struggling and struggling with yourself, right? Or a burden, and you feel that energetic shift where you feel a little bit lighter. You feel that energetic shift where you feel, oh, it's flowing. I'm not fighting with myself. That's what self-compassion feels like. Right? Remember, we say if it feels like a struggle, if it feels like you are fighting with yourself, that's not self-compassion. So let me share my screen again. I just want to give you some tips about how to use it. How do you use this practice? Okay. So practice in daily life when you notice strong emotions. Remember, this practice itself, it doesn't solve problems. It helps you to soothe emotions. It helps you to take care of your emotions so that you can be your best self. Once you practice, your problem solving will be better. Or maybe you will realize, oh, there's no problem. It's just being human. But also remember to be flexible and creative. Remember that when you practice, after learning today, or maybe after taking the course, you will be the cook in your own kitchen. So you have to be flexible and be creative, and you have to make the recipe for yourself. Now I want to move on. I want to teach a separate practice, because this is also, there's another way to really support ourselves with self-compassion, which is to generate some positive feelings. So I want to teach a gratitude practice, and it might be and this is a kind of gratitude and mindfulness practice, because in English we say not every day is a good day, but there is good in every day. Because gratitude is a powerful positive resource, and it can actually help recharge us. It can give us energy. It's research shows that, research shows that gratitude is very, if your mind is like a whiteboard, and we can get all these things written on our mind by the end of the day, like stress and fatigue and self-judgment and anger at other people and frustration and hopelessness, right? There are certain things that help to wipe the whiteboard. And gratitude is one of those things. It helps to kind of reset our mind. Social support is also another thing. But today I want to teach you a practice that you might like to use. And I think some of you already do this, but this is, I want to talk about this. So this is a wonderful, simple, quick practice, which you will see. It's a wonderful way to nourish yourself. We call this practice gratitude for small things. So here's what I want all of you to do. I want you to make a list. And again, I want you to write down 10 good things that you experienced in the last 24 hours. So it's the middle of the day on Saturday. So basically since Friday, 10 good things. And it doesn't have to be big things. Maybe you had some noodles and you thought, oh, these are good noodles. I like those noodles. It made you smile. Okay, that's one good thing. Or maybe you realized, oh, for me, it's always comfortable shoes. If I have to wear like heavy wooden shoes, it makes my feet hurt so much. So I always like soft shoes, like Skechers. And I'm always so grateful for my Skechers, for my soft foam shoes. So that's one thing. So what is it for you? Or maybe you had electricity yesterday for a few hours. Or maybe, so please write down 10 things. If you are able to write 10 things very quickly, please continue, write more. If you're having difficulty, because life right now, please keep trying. Sometimes we feel very dark. We feel, oh, there's nothing good in life, and it's difficult to see the good things. And that can be normal. That can be part of being human. So please do your best. Okay. Now that's not the practice yet. That's not the practice. Now we're going to do the practice. So first you make your list, and now we're going to practice the gratitude. We're going to try and soak. Like when we do laundry. And first we put the laundry in the water, and we put the soap in, and we let it soak. We let the cleaning power of the soap soak in the fabric. So we want to soak in the gratitude. So here's what I want you to do. And see if you can do this. I want you to do this like slow-mo. I want you to do this slow motion. like on TV when the picture is very slow. So I want you to imagine, don't rush. So look at the first item on your list. Just focus on that. Look at the first item on your list and breathe. And remember how you feel about that. Like when you ate the noodles, remember how you feel when you taste the noodles. And just take a moment to feel like, oh, that you feel like you're glad. Like if you didn't have that in your life, how would you feel? Right? So read each item, breathe in and out 1 or 2 times, and really feel the sense of, oh, that's a good thing. I'm grateful I had that today or yesterday. And then do the next item. So just do this kind of read the list and feel that gratitude. And when you finish your list, just close your eyes and notice how you feel. Notice how you feel when you turn your attention to these good things. Not every day is a good day, but there are good things in every day. And again, just notice what that feels like for you and ask yourself, okay, does that connect? Does that energize me? This is not a practice of you telling yourself, oh, I should feel grateful. What do you feel? Some of you will find that this is very energizing. So this is very valuable. So again, let me give you some ideas about how you can practice. Remember, it's not just about thinking. You're using a mindfulness skill to really focus on this thing. Right? So you make the list, and then you do the practice of really spending some time with each item. So I suggest that you practice either at the end of the day or at the beginning of the day when you're going to sleep or when you're waking up. But you could try to practice anytime. Now, something very important. Do not use this gratitude practice to fight with your painful feelings or stress. Very frequently, people use a positive feeling to try to resist a negative feeling. So for example, maybe someone's feeling very stressed and they're saying to themselves, and this is so common, stressed or upset or sad. And the person says to themselves, I should not feel sad. Look at all the things I have in life. Let me make the list, Dr. Ben said. I'm going to make the list so I won't feel sad. This is not a skillful way to practice. That is resistance. And very frequently, it does not work. It just makes us more unhappy. Then it doesn't work. And we say, what's wrong with me that it doesn't work? If you have painful feelings or stress, practice the self-compassion break first. So we use this, if you have painful feeling, if you have some suffering, practice the self-compassion break. And at other moments, again, a moment that feels, perhaps neutral, or you feel, again, when you're about to go to sleep or when you wake up, try practicing this gratitude for small things. But don't use it to fight with yourself. Okay, good. Now I want to teach you, I have 2 more practices that I want to teach you today. Again, I think the team may have mentioned to you, we are going to run over. But I have 2 wonderful, wonderful practices that I want to teach you before we finish up. The next practice I want to teach you, in English, we say, be your own ally. Which means, and very specifically, this is a practice to recognize and reduce self-criticism, self-blame, and guilt. It is really remarkable. And I'm American. Even though I've been living here in Asia for more than 20 years, and I have had the wonderful privilege, the wonderful honor to work with so many people and to train and teach in Myanmar and Thailand and Singapore and around the region. I have seen that self-criticism and self-blame are universal. There is no country where you can go to where people do not have self-criticism. But of course, this is the common humanity. It's something about our brain. And most of us, we don't treat other people this way. We don't, you don't attack your friend. You don't criticize or blame your friend the way that your mind criticizes and attacks you sometimes. Now, everyone is different. Some people do more of this and some people do less of this. But this is very common now. So we need some tools to work on this. I already said that. Now, I want to talk about a special form of self-criticism as well, which is caregiver guilt. Caregiver guilt is a kind of self-criticism. Because right now, the situation that you are living in Myanmar, the social needs and the needs of people are traumatized and stressed and desperate and afraid and angry. The needs are enormous. And in fact, no matter how hard you work, there's still more suffering. The suffering is vast, like an ocean of suffering. That's not your fault. So many caregivers have very guilty feelings and thoughts about this because they feel responsible. Some feelings like, I am not doing enough. I should be doing more, because we see that there is still suffering. Or maybe when we talk to the person, we can't fix the problem because the problem is that the society is broken. And we can't fix that for people. But still, because we care and we have a lot of compassion for other people, we feel responsible and we want to help. So we get caregiver guilt. So this practice we can also use for caregiver guilt, because this is a subtle form of self-criticism. So I'm going to teach you the practice, and we're going to do the practice 2 ways. We're going to do the practice by visualization, and then I'm going to ask you to write a note to yourself when we finish. So please have a paper and pencil ready so that you can do some writing when we finish. I'm going to ask you to write, when we finish, I'm going to ask you to write a little kind of note of encouragement to yourself. But first, let me teach you the practice. And this is very similar. Oops, I'm sorry. This is very similar to the self-compassion break. It's very similar to the self-compassion break, but the focus is on self-criticism. So again, step 1 is the mindfulness. You have to notice when that self-criticism, self-blame, or guilt, you have to notice when they are arising. They are coming up in your mind. And then you stop. This is so valuable. You stop and you breathe, and then you imagine your friend. What would you say to your friend? Okay, so let's practice together, okay? Please put down your devices. In fact, before you practice, you might like to take a moment to stretch a little bit. We've been sitting for a long time. You've been listening to me talk and Agnes for a long time, so it's good to stretch or move your body a little bit. And then when you feel ready, again, set aside your devices, set aside your pen, let your hands be empty, and close your eyes. And think about something that you criticize yourself about, or something that you blame yourself about. Or maybe again, think about your guilt as a caregiver, that you feel like, oh, I'm not doing enough. I need to do more. So please picture this moment or this experience in your mind's eye. Please picture this moment of self-criticism, self-blame, or guilt. And then stop and take a breath. Take a breath. And again, this is so useful. Put a hand over your heart as a symbol of self-compassion, and ask yourself, take a breath and ask yourself, if you had a dear friend and your dear friend was criticizing themselves or blaming themselves in this way, or your dear friend felt guilty, what would you say to your friend? What would you say about their self-criticism? How do you see the situation? Really trying to imagine how you would support your friend when they are, to help them be less self-critical, to help your friend have less self-blame, to help your friend maybe see things more clearly and have less guilt. What would you say to them? And if this is difficult, that's okay. Please understand that you are a beginner. That if you never did this before, this can be difficult. But if you find some encouraging words to say to your friend, what I want you to do is to open your eyes, and I want you to start to write a little note to yourself. So you begin the note, you can write, dear, if I was writing the note to myself, I would write, Dear Ben. Or if Agnes were writing the note to herself, she would write, Dear Agnes. So just start writing, Dear Ben. And then those words, maybe I would say to myself, I know you want to help so many people, but this situation is very difficult. Please excuse yourself that you can't help everyone or you can't help all the time. Please take good care of yourself. Whatever the words are for you, just write a little note to yourself. The same kind, understanding support that you would give to your dear friend. Okay. So again, just take a moment to read your note. Just take a moment to read your note. And if you like, I strongly recommend, so this is you may also like to take a picture of your note so that you can carry it with you to remind yourself wherever you go. Because when you notice self-criticism, especially when you are a beginner, this practice may be more effective if you stop and write the note. So you visualize when you practice, and then you write a note. But you may not always have time to do that. So you might just like to visualize or open your phone and read the note you already wrote. But remember, because you're just a beginner and you are developing this skill, the note you wrote today might not feel the same next week, like it connects. So next week you might need a different note or different words, because our needs can change and be different, and we develop in our skill of supporting ourselves. So please be aware of that. So if you, okay. So now I've shared with you 3 skills. Let me just, okay. So now I've shared with you these 3 skills. The soothing touch is easy, it's very immediate, but we did the self-compassion break, which has those 3 steps. We did the gratitude for small things. And now we just did be your own ally, to take care, specifically to take care of self-criticism and guilt. So I think this, Agnes mentioned this to me, and I think this is a very important issue as well, this issue of caregiver guilt, right? Because you have to remember that you are like someone who's running a marathon, and you need the energy to finish the marathon. And some caregivers have this belief, not just, a belief is that self-care is selfish. We can see this because people say things like, I don't have the time to take care of myself. I have too much to do. So I'm not going to go for a walk or exercise because I have to do these other things. Caregivers who don't have regular self-care become less effective and may burn out. And one thing you have to understand as a caregiver is taking good care of yourself is part of taking care of other people. It's not something selfish you do. It's like what we said, put your own oxygen mask on first. During a marathon, you may need to take water breaks. You may need to slow down and walk. Look at this lady. This is an actual picture of an elderly lady who finished a marathon. This elderly lady, I'm sure she did not run the whole way. She may have walked part of the way, but she is able to finish the marathon. So it's very important that you have, and hopefully some of the other people in this in the webinar will talk about this. You can say that self-care has five elements. And some of you gave examples of this earlier. We can say that there's physical self-care, mental self-care, emotional self-care, relational self-care, and spiritual self-care. So, and this is a real form. This is also learning using self-compassion to be able to sometimes say no, or to make a space in your life so that you can practice self-care is a real form of self-compassion. So sometimes, as I've already said, self-compassion is something you can practice right here, right now. You can do the self-compassion break almost anywhere, anytime. But self-care also matters, and it's real self-compassion to create the space and create the time in your life so that you can do your self-care. That's something very important and very meaningful for all caregivers. So I don't want to ignore, even though we're talking about self-compassion, I don't want to ignore self-care. Now, before we finish, I want to offer you one more practice. I want to offer you one more practice where we use our breath and use our self-compassion to protect us when we get overwhelmed right at the moment that we are taking care of someone. We can use self-compassion even when we are with another person. This is something I do regularly. Because again, because of our human brains, emotions are contagious. When we sit with another person and they're suffering, we will feel their suffering. And at the same time, we will also have our own suffering, like, oh, I want to help, but I don't know what to do. And compassion and empathy are different. Empathy means I feel what you feel. Empathy uses energy. Compassion means, in the simple way, it's not so simple, but the simple way of explaining compassion is to say compassion is kind wishes, right? It means I wish for you to be free of pain. Even if I can't make it happen, I still wish for it. I wish for me to be free from pain. I wish well for you. I wish well for me. Even if I don't have the power at this moment to make it happen, I still wish it. And compassion gives energy. Empathy, I'm not saying one is good and one is bad, but this is about the energy. Empathy uses energy. Compassion gives energy. So I want to teach you a practice that we call, actually different teachers have different names. Some teachers call this giving and receiving compassion. And some teachers call it breathing compassion in and out. It's a very powerful, wonderful practice that we can learn. And and it's very simple. I want you to, so we're gonna try it right now. And then we're gonna practice it. So I want you just to imagine, so just sit in your chair. Sit in your chair. You can close your eyes, but if you're gonna fall asleep, don't close your eyes. Keep your eyes open, but look at the floor. close your eyes and just breathe. Take a few breaths and just feel your body breathing. Feel the air filling you up. And then notice how it feels when you breathe out. Do that 4 or 5 times. Breathe in, breathe out. Now, just let your body breathe normally. But now, when you breathe in, focus on your in-breath, and I want you to imagine that you are breathing in kindness. Like maybe you're breathing in a wish, like, may I be well. May I live with ease. These are phrases we use in English. You may have different phrases in Burmese, but just the idea that you're breathing in, or maybe you can visualize you're breathing in light. You're breathing in a rainbow or a light that's good for you. But the idea is just imagine each time you breathe in, you're breathing in something good for you. Just try that for 1 minute. Each in-breath, you're breathing in something good for you. Again, it may be kind wish, maybe some other form of energy. And now, I want you to visualize someone you know, like a friend of yours, someone in your family. And each time you breathe out, I want you to imagine that you're sending out compassion to that person, meaning you're sending out a good wish, like, may you be well. May you live with ease. Or maybe just imagining you're sending out a healing energy or a light to that person. So again, if many, many people come up in your mind, please just pick one. Give yourself permission. It's okay. Give yourself permission to just pick one person. And then each time you breathe out, you send out something good, some good wish, some good energy, just a little bit for that person. And now, again, put those two together. So each time you breathe in, and if it helps you to focus, put your hand over your heart. Each time you breathe in, breathing in some compassion for yourself. May I be well. And each time you breathe out, sending out some compassion for this other person. Breathing in for me and breathing out for you. And let's just try that for 2 minutes. So again, and then again, release that for a moment and just notice how that feels. And again, remember, please give yourself permission to be a beginner. It's maybe the first time you've ever practiced this. But the general principle is you're breathing in the energy of good wishes for yourself, and then breathing out good wishes. Because there's so many things in life we can't control. And some of the caregiving situations we deal with when we're trying to care for other people, it's so difficult. We start to feel powerless or helpless many times. I can't help, or there's nothing I can do, or I don't know what to do. I don't know how to help, or it's too much. We feel overwhelmed by the person suffering. This is part of our job. We all feel this. We all feel it. I feel it every week. I've been doing therapy for 25 years. And when I am sitting with a patient who's overwhelmed with suffering, I still have some of this reaction. Because I can't fix people's lives. I can help them go through it, but I can't fix their lives. It's not my job. I don't think of it that way. So this is a very powerful practice for a caregiver with a patient or with a client. It's for you. This one is not a skill you teach. This is one you practice for yourself. So now let's try it. So now we're gonna try it in the actual situation where you are giving care and the other person is difficult. So now, this time, please close your eyes. And I want you to visualize a client or a patient of yours or someone you are caring for who is very difficult, it makes you feel uh, 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 helpless or powerless or angry. I want you to visualize yourself. Again, if possible, don't choose the most difficult patient you have or the most difficult, but one you find challenging. And I want you to visualize yourself on the Zoom with that person or in the room with that person and how it feels to be with them. Maybe they are overwhelmed, or maybe they are angry. And you feel frustrated or helpless or overwhelmed. So now take a breath. Feel your body in the chair. And begin to breathe in. Breathing in some compassion. Breathing in, saying to yourself, may I be well. This is a difficult moment. May I be well. Breathing in some good wish or some good energy for yourself. And then as you breathe out, you see the other person's and you breathe out some compassion. May you be well. I see that you are suffering. And even if I cannot fix it, I cannot make the suffering go away. I want to send out the wish, may you be well. Or any energy you can send out. So breathing in, visualizing this difficult patient. And breathing in compassion for you. May I be well. And breathing out compassion, breathing out a good wish. Again, stopping, releasing, and just reflecting. How does that feel to you? What do you experience? Making some notes for yourself. So we've talked about a lot of different skills today. So we let me share my screen. Right, we've talked about the 3 self-compassion questions, the stop practice, soothing touch, the self-compassion break, gratitude for small things, be your own ally along with the compassionate note, and this giving and receiving compassion, which is a caregiver practice. And we've also talked about these topics. What is self-compassion? What is resistance? The fears and doubts about self-compassion. So I'd like to invite everyone now to please take a moment to reflect for yourself. What do you want to remember from this webinar? Which skills have connected the most for you today? Please take a moment and write down again for yourself, just for yourself. It's not a test. There's no grade. Just taking a moment to write down which skills do you want to keep using? Yeah, and if you like, again, remember these notes are for you, but if you like, now you can also share in the chat. What is the thing that you will use from this webinar? What is the practice that really connected for you today that you want to start using tomorrow? Okay, some people are saying 5 senses and the gratitude for small things, the 3 questions, the self-compassion break. I'm treating myself like a dear friend. Wonderful. Yeah, and of course, yes, again, please feel free to write in Burmese so you can see what other people are sharing. So now we also have some time for Q&A about self-compassion. Apu, do you already have some questions that people have been asking? Or should we ask people to raise their hands?
Yeah, I only got one question. Someone sent me direct message and like she wanted to know that how to handle or deal with having repetitive bad emotions that she receives related to existential crisis. And she said that she even tried some coping strategies and mindfulness practices, as well as some counseling sessions. But she keeps coming back to being depressed and painful feelings, except getting a bit of temporary relief while doing that.
Okay, so that sounds like the person asking the questions coping with a lot of suffering, that they're carrying a really big burden of suffering. And at the same time, that person is probably also doing a job and helping other people and helping their family. There's, you know, I hear a lot of burden. So I think that, and I hear a lot of responsibility in the question. The person is already taking many steps to try to take care of it and be responsible by going to counseling and by practicing mindfulness. So that's all really, really good. I hope that these practices, I would hope that maybe that person could practice some of these practices, and that, like the self-compassion break, definitely the self-compassion break, as a way to support himself or herself as they're suffering. And then they can notice, because if they practice the self-compassion break, and then they may notice that they feel a little bit better, but the suffering didn't vanish. And then they may say to themselves, oh, it didn't work. It didn't work. But then we learned already that this is from a resistance. If you're fighting with the experience has more power. And this is very difficult when we have big suffering. If we're exhausted from being a caregiver and we have suffering in our own life, and now our mind has formed a depression, our mind and our body have formed a depression, which can happen to any of us. That's a lot of suffering, and it will not vanish in one day or 1 week or 1 month. But in our mind is trying to get rid of it. Like we have a Harry Potter magic wand. We should just be able to go abracadabra and it will vanish. And it just doesn't happen. So that's why self-compassion is so important, to be able to say to ourselves, today I'm suffering a lot. And I cannot make this suffering disappear. I cannot. No one can. This is part of being human sometimes. I cannot make this suffering disappear. I wish I can be a good friend to myself while I'm suffering. If I had a friend who's suffering and I couldn't change the suffering today, what would I offer my friend today? How would I support my friend while they are suffering? This is the essence of self-compassion. Our intention is not to make suffering disappear. Our intention is to be a good friend. Sometimes our friend is suffering a lot and we cannot remove the cause of their suffering. We cannot remove the cause of their suffering today. Maybe we cannot remove the cause of their suffering at all. I think of one example is some people who work, caregivers who work in palliative care. But that does not prevent us. We can still offer compassion to our friend. We can still be a good friend today. And this is the power of self-compassion. So when you're suffering, I would like to encourage this person, keep doing, I hear a strength, and I hear a lot of good things. And I want to encourage that person to keep doing those good things. And please try practicing self-compassion. Try really letting go of the resistance to this sadness, and see if you can be a good friend to yourself. But it's great also that you are getting going to counseling and getting professional help. Use all resources that are available to you. I see that there's also a question in the question, which is, are the violent acts of some people to families, neighborhood, and society are ways of outlets of consequences of being traumatized and stressed? It's a little bit outside the scope of the topic, but yeah, I mean, in English we say hurt people, which is confusing, but means that people, particularly men more so than women, but women also, but people who have been traumatized and abused are so much more likely to become the perpetrators of abuse and traumatize other people. So it's really important to and that we know when there is conflict, social conflict and war, that the levels of violence increase in a society. The general levels of crime, violence, domestic abuse also increase in that society, because this is yeah, it's just a fact. So that is when there is social upheaval, when there is a civil war, the general level of violence will increase at all levels. So it's really important when we will feel the energy of anger. We will feel the energy of frustration. We may feel the energy of hatred, because we are human. These things will arise. And they are moving through society like a wave in a swimming pool, back and forth, and we are feeling the energy of this wave. So it's very important when you feel these things, when you feel hatred of other people, or you feel the wish that other people would die, it's important to recognize that this is suffering. When we are hating someone or we want someone else to die, and again, it's very human. There's nothing abnormal about that wish, but that we ourselves are suffering at that moment, and our mind is suffering. And so that can also be a very good moment to practice self-compassion, to recognize, and to really recognize that my suffering is not my fault. My whole society is suffering. Everyone is suffering right now, and the suffering is very great. So it's not my individual suffering alone, even though, of course, it feels that way. But I'm receiving the energy of the trauma that the whole society is experiencing. And I can perhaps take good care of this little piece inside of me so that I can offer something to other people. Because when you have peace, or when you have some moments of peace or the energy of peace within you, even just for a few moments, because you practice gratitude and that gave you the energy of peace, or because you did the self-compassion break and it gave you the energy of peace, then you can offer that to your family, to your people that you are giving care for, and you can offer that to your community. But that takes energy that we have to work on day by day. Are there other questions? Apu, you're muted.
Yes, thank you. So yeah, one last question left. Hi, I would like to know, how can self-compassion be balanced with the need to address and confront harmful behaviors or injustice during a conflict.
So I'm going to assume, does the person, so I'm going to assume that that means an interpersonal conflict. I'm going to assume that that means a conflict in my family or a conflict with my friends. If the person who asked the question would like to add more details, you can raise your hand. But otherwise, I'm just going to assume that this means that we're talking about like at home or at work. So I think that self-compassion can help a lot in this situation. But it's going to come from the fierce side of self-compassion. Because the fierce side, which we really didn't focus on today, although when we make space for ourselves, when we say no, we're using the energy. So for example, when we practice to be your own ally, you notice that you kind of have to say very gently, you're saying no to self-criticism in a loving way when we practice that, right? So you're using the energy, that's that yang energy of fierce self-compassion. When you say, no, I'm going to speak to myself in a loving way. So that there's an element of the firmness there. So when we see that someone else has harmful behavior, and of course it depends, sometimes we need to stand up and we need to have a non-violent way to speak and to say no, or to leave that situation or give feedback. And this is very important. And so, but we might feel afraid. We might feel, you might feel anade, or you might feel afraid to speak up, afraid of judgment or afraid of the consequences. So it is important to find, and so we need the courage. We need the courage and the fortitude to stand up and to be able to speak, but speak in a nonviolent way, so that the fierce side of self-compassion, which is very valuable, that we can learn how to develop our courage to speak to others, and to both, we can use our courage to support ourselves, and we can help others to receive that feedback and to perhaps change their behavior as well. Although the important thing is that we speak up or find another way out of that situation. There's for those, and of course there's a limit to how much self-compassion I can teach you in 3 hours. The full self-compassion course is almost 30 hours. And many people take the course 2 or 3 times to learn all of the skills and practice the skills. But again, there's many videos on YouTube. If you're interested, you can watch the videos by Kristen Neff. If you are able to understand English, I suggest you watch those videos by Kristen Neff, who's a wonderful speaker and a wonderful, has many good examples, especially about fierce self-compassion. I think that can be something really amazing if you're able to follow along. If you're able to follow along, you can learn a lot from watching her videos. In case you're interested, I want to share the playlist. I shared a link for those of you who can go along in English. There's a list, that's a list of videos of Kristen Neff on YouTube. And Kristen Neff has many practices on her website. Now, for those of you who'd like to follow along in Burmese and understand, because it's very important, there are cultural issues and communication issues and language issues. Has a podcast. You can use also, and let's, because I really, I'm sorry I didn't do that sooner. Agnes.
Yes. Okay. So, thank you very much, everyone, and also Dr. Ben for your valuable time, and everyone also for joining from all the difficulties. They try to stay till the end, even though we go beyond the time.
Yes.
And I hope all these little practice, as Dr. Ben said, it is focusing on you to start having built peace in you so that you can be able to share that peace with the people who you are caring. Thank you once again, everyone. I don't have much words.